Hello, I'm Taylor Boudreau, and I'm here doing the health, family, and risk analysis with my mom. So I'm Taylor Boudreau. I'm a family nurse practitioner student, and I'm just going to be getting your overall health history and risk analysis done. So tell me a little bit about yourself, your name, and your date of birth, and your age.
Okay. I'm Melanie Britton.
Okay.
And my birthday is May 21st, 1961, and I'm 59.
Okay. All right. So tell me a little bit about yourself. Any significant childhood illnesses or chronic illnesses?
No, I didn't have any. I had usual like chicken pox, like everybody in my generation.
Okay.
I did have an allergic reaction one time to sulfa.
Okay.
And that was pretty severe.
Okay.
In fact, my parents had to take me to a doctor's house that night, and I had to have a shot. My face was swelling, my throat was swelling. I had whelps and
Okay, so yeah,
rash,
pretty
and
severe.
my eyes were watering, and
Okay. All right. And what about chronic illnesses that affect you now?
Well, I was diagnosed with rheumatoid arthritis many years ago, and I was on medication for many years.
Okay.
But it was mild, and my rheumatologist decided at one point to try me without medication, and we did, and I have been really okay without it. I also have osteoarthritis, which affects some of my joints, but I have not been on medication for rheumatoid arthritis for many years, but I go regularly for checkups for that.
Okay,
and
good.
I just had some blood work done. I have x-rays done on my hands and feet every year for that.
Oh, good, good. Okay. I'm just going to write that down. Okay. Anything else other than arthritis?
As far as I have high blood pressure.
Okay.
And I do take medication for that.
Okay.
I take losartan.
So it's well managed. That's good.
Yes.
Okay.
Yes.
Any prior illnesses or injuries that required a hospitalization?
I've never been. Well, I had outpatient surgery. I had two surgeries on my both knees at different times. I had torn meniscus in both knees, and then I fell and injured my shoulder and had shoulder surgery. But all three of those were outpatient surgeries.
Okay.
Yeah.
All right.
I've just had like my wisdom teeth removed when I was a teenager, and had another abscess tooth removed recently that I'm getting a implant for.
Okay.
So.
All right. So we'll talk a little bit more about your general health status. How do you feel like your current health status is? What's your feeling of your?
I feel like I'm in pretty good health for my age.
Okay.
Yeah.
Good. Let's see. So you said you were allergic to sulfa and you had a pretty severe reaction, facial swelling, hives, the works.
Mm-hmm.
So no other allergies that you know of. So that's good.
Mm-hmm.
And so you also said you have hypertension, and so what medications do you take for your hypertension?
I take losartan, and I think it's 100 milligram tablet every day.
Okay. Mm-hmm. And any other medications that you take?
Yeah, I take. I also have acid reflux.
Okay.
And so I take Nexium, prescription 40 milligrams, and then over-the-counter Nexium 20 milligrams, and I alternate those.
Okay.
I think it has to do with calcium absorption issues or something. My doctor would just want me to try, both, alternating those. And then I take Citracal.
Okay.
Those are the only two prescriptions, losartan and Nexium. And then I take over-the-counter Citracal 1,200 milligram calcium tablets is 1,000 IU with D3. And then I have an additional D3, 25 milligram, which is 1,000 IU. And then glucosamine and chondroitin, 500 milligrams
Okay,
each.
good. So that's a good joint supplement as well.
Mm-hmm.
Okay. Any history of tobacco use or current tobacco use?
No.
Okay, good. Any alcohol use and frequency?
Yeah, I do drink, and I would say, weekly, like on weekends.
Okay.
Especially, I generally don't drink during the week. Occasionally maybe a beer or two during the week. And I just drink like beer, on the weekends. Just kind of a social thing.
Any current or history of illegal or recreational drug use?
No.
Okay. Any environmental hazards that you can think of?
Well, COVID.
Yeah.
That's the biggest,
a big one.
That's the biggest one I've ever had.
Yeah.
But as far as my home, I think our home is safe. We have smoke detectors and
good. Okay.
Getting ready to actually do some radon testing. I've heard about that, and we're
good.
going to check that out. And but I think our house is pretty pretty safe.
Good. And as far as COVID, you wear a mask and social distance?
I
all
do,
that?
and I keep hand sanitizer in my purse and in my car.
Okay.
Mm-hmm.
Good. And tell me a little bit about your exercise routine. How active are you and how frequent?
Yeah, I do exercise regularly. We have an elliptical, and so I exercise for an hour each time I do it, and I try to do it every day, but it probably averages out about 4 to 5 days a week.
Oh, good.
I do that.
Good.
In fact, a year ago, I have exercised off and on through the years, and I had kind of gotten off my schedule, and at my annual checkup, my cholesterol was a little high, and she said, well, why don't you get back on your exercise routine? We'll check it every 6 months.
Mm-hmm.
And so the last 2 6-month checkups, it has been reduced significantly to the point where I don't need medication right now. But we're keeping an eye on it.
Good. And tell me a little bit about your sleep. Do you feel like you get enough sleep, and are you getting restful sleep?
I do. I go to bed early, but I'm postmenopausal right now, and I still have some hot flashes that wake me up in the night, and I get really hot and kick the covers off, and it wakes me up. Yeah. But then I'm able to go back to sleep.
Good.
So I do have interrupted sleep, but I sleep enough that I feel rested. So
good.
Yeah.
Good. And tell me a little bit about your diet. Just a rough 24-hour recall about what you eat, water intake, caffeine intake, things
Actually,
like that.
I've done better with my water intake. I used to drink a lot of Diet Cokes. Like several a day. And I have substituted those for sparkling waters, the canned waters.
That's a good substitution.
Yeah. So I feel good about that. I still drink, a little more Diet Sunkist every now and then than I probably should, but I feel good about that. In my diet, I'm usually a pretty good eater. I don't like a lot of fried, heavy, fatty things. I'm pretty good like baked foods. I love.
Okay, good.
So I think I have a pretty good diet.
Good. Okay. All right. So tell me about your immunizations. I'm sure you're up to date with all your childhood immunizations, but any pertinent immunizations for your age and yearly vaccinations?
Yes. Just recently I had my annual checkup, and I had a tetanus shot.
Okay.
So I hadn't had one of those in a long time. So
good.
And I have a flu shot.
Do you get that every year?
I do.
Okay, good.
And I've had shingles, both. It's a 2-part series. I've had both shots for the shingles.
Good.
I'm not due for my pneumonia yet. Since I'm 59.
65 or older.
Okay.
Yeah.
So that hasn't happened yet.
Good.
Yeah.
All right. And what about preventative screenings? I know you said you're really good about following up with your doctor. So at your age, what kind of preventative screenings have you been doing?
Okay. I get a mammogram every year.
Good.
And I have that coming up soon. And I get a pap smear every year, and that'll be due in April. I'm due soon for a colonoscopy. And I have those, however frequently. I think it's every 5 years or something. I can't remember now. But
I think it's 5 if you're at higher risk. Or if they find like a polyp, and then it's every 10 generally.
Yeah. Okay. But anyway, my doctor told me recently, within the next year, I think I'll be due for that again. Okay. And she'll let me know about that.
Good. And are you getting any kind of scans for your arthritis? I know you said you get x-rays.
Yes, I do. I get x-rays in my hands and feet every year. And then she ran another blood test. And I'm still, I still have the RH factor, which, she was just checking because she had not actually done when I was referred to her years ago, and she'd not actually run it. So she did it, and it was still there, but it's just, I guess, in remission.
Okay, well, good. All right, so tell me a little bit about your family history. So that would be your parents and your grandparents.
Okay. Heart disease runs in my family pretty strongly. In fact, my father passed away at age 68 with severe heart disease.
Okay.
He had 13 angioplasties, triple bypass surgery, carotid artery surgery, a defibrillator. He died of finally a stroke, and then both of his parents died of either stroke or heart attack.
Okay.
My mom has high blood pressure, and then both of her parents died of either stroke or heart attack.
Okay.
So it does run in our family. So my doctor keeps a very close eye on that for me.
Good. Okay. All right. So tell me a little bit about your social history. We're going to go over some things. What's the highest level of education you have?
Okay. I have a specialist degree.
Okay.
So I got my bachelor's, and then my master's, and then my specialist. And,
okay.
in education.
All right. And what do you do for a living?
Well, I'm retired right now. Before I retired, I was a special ed director for a school system for many years, 23 years, and prior to that, I was a special ed teacher. But I retired, but I'm still working part-time,
Okay.
49% time. I'm the regional director for student services for Foothills Education Charter High School.
Okay. All right. And what's your marital status?
Married.
Okay. And tell me a little bit about how many children you have and any dependents you have.
Okay. I have 2 children.
Okay.
And my mother, who will be 89 next month, lives with us.
Okay. And what type of housing situation do you have and who lives with you?
Okay. We own our home, and right now my mom lives with us, and my daughter and her husband have a little basement apartment in our house while they're finishing their education and getting things squared away. So.
Okay. And tell me about how you feel as far as your financial resources and your insurance.
Yeah, I think we're very, very stable. I do draw my retirement pension right now, and then of course I have the salary. And then my husband is going to retire actually in about 3 weeks.
Oh, how
he
exciting.
has a good retirement. And,
Okay.
We both have medical insurance, and I actually have a life insurance policy still that will lapse, I think, in about 6 years.
All right.
So we're good with that. Yeah.
Okay. And what's your religion or belief system?
I'm a Christian.
Okay.
And grew up in the Methodist Church and raised my children in the Methodist Church. And as an adult, I've maintained a relationship with our church, although recently haven't been in a while. But
all right. And tell me a little bit about your social involvement. I know you said you have a lot of good friends and you feel like you have a good social life.
Kind of a close-knit group. I'm not, I'm not on Facebook, but I have several very close friends that I stay in touch with, and family.
Okay.
Yeah.
Good. And tell me about your travel. Do you travel a lot for work, or do you travel for leisure?
Well, right now, no one's traveling much.
Anywhere.
But, pre-COVID, with my work, I do visit a lot of the sites, the schools that I'm responsible for. But they're kind of local. I mean, they're just, within, some are 10 minutes away. The most is like 45 minutes away.
Okay.
And, try to, again, pre-COVID, try to take a trip, if we can every year, although that has been a little more limited with my mom now. My older brother, who was kind of helping out with her, has moved to Canada, he and his wife.
Mm-hmm.
So I don't have as much help with that right now to do like family vacations or something. But anyway, that's all good. That's okay.
So at your age and where you are and what I've heard, it sounds like you fall under Erickson's 7th stage of development, which is generativity versus, oh gosh, I forgot hold on. I don't want to mess it up. So this would be generativity versus stagnation. So you are currently nurturing things that will outlast you and hoping to benefit the future generation. And it sounds to me, you were talking to me about your family history, it sounds like you have some pretty significant cardiac history, and you said you already have hypertension, but it sounds like you're very active. You exercise 5 days a week, and it sounds like you're doing some really good exercises there, which also helps with arthritis. A lot of weight-bearing activity helps maintain your bone density, and that's really good. You follow up regularly, and you get a lot of testing done, so it sounds like you're doing everything that you can to alleviate any kind of complications from those conditions, so I would say that's good. I would just encourage you to continue staying on top of your medication, following up with your primary care physician, and maintaining your blood pressure, and, continuing to stay active and watch what you eat, but it sounds like you're doing the right things, so it was nice to talk to you. And
all right, well, thank you so much. I've enjoyed this conversation.
Okay.